How should I express praise and care? Expressing praise. Appropriately expressing praise not only helps patients to acquire good habits, but also boosts their confidence and strengthens the family relationship. When we praise them, the following techniques can be considered. Closely observe, provide instant feedback. As we have been living with our family members for a long time, we may not notice their strengths or room for improvement. When we closely observe, we can realize their strengths, and then we should instantly express our praise. Make clear compliments. Explain the reason. We need to clearly explain what they have done that is worth praising and why. Expressing our feelings. We can express our present feelings. We can also consider using more precise vocabulary, such as praising their good qualities, such as being caring, responsible, credible, respecting others, diligent, organized, persevering with difficult or boring tasks. For example, we can say, "It is such good self-discipline that you wake yourself up. I'm glad to see you are working hard." Expressing care. Concisely describing the patient's condition can be one of the ways to show care. For instance, we can simply say something like, "After a day of work, you look a bit tired." We should be careful, while expressing care, also to respect the patient's autonomy. For instance, when the weather is cold, we do not need to ask repeatedly for them to wear more clothes. Instead, we can simply put a coat onto the chair and provide them with the space to choose. Looking for topics of conversation. Sometimes we may find it difficult to communicate with patients or do not know what to say to them. When we don't have any idea of what to say, we can try the following ways. Describing our thoughts precisely and concisely. It is not a must to prompt patients to talk by asking questions. We can describe their condition briefly, such as, "You look tired," to start conversation. If we really hope to start a conversation by asking questions, open-ended questions are more appropriate. Disclosing your own thoughts. To start conversations, we can also disclose our thoughts and feelings first. If a common topic can be found, for example, television series, news, or the latest information, it is easier to start the conversation this way than talking about your own matters, for example, your work.